A few years ago, my sister discovered she had prediabetes after a routine blood test. For her, daily insulin injections and the health problems that come with diabetes were no mere abstraction. She had been giving her mother insulin shots and taking her to doctor's appointments for years, and she did not want to travel the same path. So she began a regimen to avoid getting type 2 diabetes. She lost weight, about 10% of her body weight, began daily walks and exercise, and started paying close attention to her diet and caloric intake. To help keep her blood glucose level within a normal range, she also monitors her blood sugar and takes metformin, which targets the body's insulin resistance rather than increasing insulin production. So far, she has averted full-blown diabetes and its consequences. My sister is one of 79 million Americans over the age of 20 who have been diagnosed as pre-diabetic. More sobering statistics, however, are these: 90% don't know they're at risk and 70% will go on to develop diabetes, according to the Centers for Disease Control, CDC. Even more significant is that type 2 diabetes, which accounts for 95% of diabetes cases, is highly preventable. Insulin is the central, underlying problem in developing diabetes. A hormone produced by the pancreas, insulin moves glucose, sugar, from the bloodstream into liver, muscle, and fat cells. Without insulin, blood glucose levels climb, leading to tissue damage and starving cells. In type 1 diabetes, the pancreas doesn't make enough insulin. In type 2 diabetes, the pancreas makes plenty of insulin, but the liver, muscles, and fat cells become insulin resistant, that is, they fail to respond to insulin. Consequences of chronically high blood sugar are accelerated aging of many tissues, arterial disease, heart disease and heart attack, stroke, eye disease, nerve damage, and poorly healing wounds. A family history of diabetes makes it particularly important to avoid these risks. Following are some tips and a recipe from 500 time-tested home remedies to help prevent the devastations of the disease. Try mindfulness meditation to reduce stress. The hormones cortisol, epinephrine, and glucagon rise during stress, thereby raising blood glucose and antagonizing insulin. Enjoy an occasional beer or glass of wine. 1 drink a day for women, 2 for men. Moderate alcohol intake correlates with a lower risk of type 2 diabetes. Get plenty of sleep. Poor quality sleep and sleep deprivation increase the risk of obesity and diabetes. Exercise every day. Physical activity improves tissue sensitivity to insulin and weight management. Eat real food rather than processed food. Real food, fruits, vegetables, fish, meat, seeds, and nuts, will help you avoid refined carbohydrates, added sugars, and trans fats, all of which promote unhealthy weight gain and increase the risk of diabetes.